Which of the following is the normal adult reference range for blood calcium levels? A. 9.5 to 11.0 mg per deciliter. B. 8.0 to 9.5 mg per deciliter. C. 9.0 to 10.5 mg per deciliter. D. 8.5 to 10.0 mg per deciliter. The answer is C. 9.0 to 10.5 mg per deciliter. The normal adult reference range for blood calcium levels is 9.0 to 10.5 mg per deciliter. What is the normal reference range for an adult male hematocrit? A. 40% to 50%. B. 42% to 52%. C. 45% to 55%. D. 47% to 57%. The answer is B. 42% to 52%. An adult male hematocrit is considered normal when between 42% to 52%. Anything below this may indicate anemia, elevated white blood cell count, or blood loss, while numbers above this may indicate dehydration, chronic oxygen deficiency, or a condition of excess red blood cell production, such as polycythemia vera. What is considered the normal reference range for an adult female hematocrit? A. 39% to 49%. B. 35% to 45%. C. 34% to 44%. D. 37% to 47%. The answer is D. 37% to 47%. The normal reference range for an adult female hematocrit is 37% to 47%. Anything below this may indicate anemia, elevated white blood cell count, or blood loss, while numbers above this may indicate dehydration, chronic oxygen deficiency, or a condition of excess red blood cell production, such as polycythemia vera. A 67-year-old male presents to your clinic with a blood pressure of 129/82 mm of mercury, temperature is 98.9 degrees Fahrenheit, and heart rate is 82 beats per minute. Blood work shows a cholesterol level of 162 mg per deciliter, fasting blood glucose of 98 mg per deciliter, and WBC count of 9,000 cells per microliters. His history is significant for street segment elevation myocardial infarction, STEMI, 7 years prior. What, if anything, would you counsel him regarding his vitals and blood work? A. His cholesterol is too high. B. His heart rate is elevated. C. Fasting blood glucose is too high. D. WBC count is elevated. The answer is A. His cholesterol is too high. All of his vitals and blood work are within normal range except his cholesterol. Normally, cholesterol is considered within normal range if it is under 200 mg per deciliter, but in the case of patients with past history of cardiac event or stroke, cholesterol should be maintained at under 150 mg per deciliter. Which of the following is considered the normal range for platelet count on a complete blood count, CBC? A. 100,000 to 400,000 cells per microliter. B. 200,000 to 500,000 cells per microliter. C. 150,000 to 400,000 cells per microliter. D. 150,000 to 450,000 cell, cell. The answer is C. 150,000 to 400,000 cells per microliter. The normal range for a platelet count on a CBC is 150,000 to 400,000 cells per microliter. Numbers below 150,000 cells per microliter may result in poor clotting ability, while numbers above 400,000 per microliter may increase risk of stroke or thrombosis. Which of the following values would be considered a normal erythrocyte sedimentation rate, ESR? A. 18 mm per hour. B. 34 mm per hour. C. 72 mm per hour. D. 45 mm per hour. The answer is A. 18 mm per hour. A normal erythrocyte sedimentation rate should be below 20 mm per hour. Anything above this indicates some sort of inflammatory process. Which of the following is considered the normal range for specific gravity on urinalysis? A. 1.015 to 1.035. B. 1.010 to 1.030. C. 1.001 to 1.020. D. 1.005 to 1.025. The answer is D. 1.005 to 1.025. While adults may have a specific gravity that ranges anywhere from 1.000 to 1.030, the normal reference range is generally considered to be 1.005 to 1.025. A specific gravity below 1.005 could indicate very dilute urine. The specific gravity of water is 1.000, and anything higher than 1.030 may be present in the case of dehydration, kidney disease, infection, or glucose in the urine. Blood pH is maintained by the body in a very close range. What is the normal range for pH of the blood? A. 7.35 to 7.45. B. 7.37 to 4.47. C. 7.32 to 7.42. D. 7.34 to 7.44. The answer is A. 7.35 to 7.45. The normal range for pH of blood is 7.35 to 7.45. Anything below that range is considered to be acidosis, while values above that range would be considered alkalosis. Recall that the main blood buffer system involves carbonic acid, bicarbonate, and carbon dioxide. Which of the following is not determined by urinalysis? A. Specific gravity. B. Presence of blood. C. pH. D. Presence of bacteria. E. All of these are determined by urinalysis. The answer is E. All of these are determined by urinalysis. A urinalysis can be an important tool in diagnosis conditions such as the presence of kidney stones, urinary tract infection, and even dehydration. A typical urinalysis will contain information on all of the parameters indicated. The presence of glucose, ketones, crystals, casts, and leukocyte esterase may also be included. Washed red blood cells are generally administered to which of the following patient populations? A. Patients with metastatic disease. B. Patients who are immunocompromised. C. Patients with a history of allergic reactions to transfusions. D. Patients with chronic kidney disease. The answer is C. Patients with a history of allergic reactions to transfusions. Washed red blood cells are generally prepared for patients with a history of severe allergic reaction to blood transfusion. Washed red blood cells are not generally required in patients with kidney disease, patients who are immunocompromised, or patients with metastatic disease.